Howdy everyone, my name is Maddie Weersig. I'm a member of the class of 2018 at the veterinary school here at Texas A&M. And today, I'm going to talk to y'all about small animal spay procedures and how they work. So a little bit about me. I'm a third-year veterinary student, which means that I've been in school for a pretty long time, but I really do enjoy it. I was an animal science major in undergrad, so I was a member of the College of Ag, and I really wanted to work on mixed animals when I get out of school. Mixed animal practice is when you work on horses, cows, maybe the occasional goat, and of course dogs and cats. And you can see right there I've got my own personal dog. Her name is Piper, and she's a miniature schnauzer. I know a lot of y'all think, well, vet school, it's really hard, there's a lot of studying and a lot of schoolwork to do, and while yeah, that is true, there's also some really cool stuff that you can get into with vet school. One of my favorite things that I've done through vet school is I went to South Africa, and we got to work on some really neat animals, like that zebra, or a red hartebeest, which is that antelope that you see right there. So vet school isn't all just school and taking notes. There's some really cool stuff too. So let's get to business. What is a spay? A spay is the common word for a really big doctor word, ovariohysterectomy. That's a really long word, but what it means is that it's the surgical removal of the female reproductive organs. This includes the ovaries, the uterine horns, and the body of the uterus. A part of the cervix is also removed, but we're going to talk about that later. A spay prevents an animal from becoming pregnant. It also prevents her from coming into heat. You've probably heard the word heat before. Heat is when an animal is receptive to the male, and it can get a little messy. And her behavior can change too, which can be a little annoying if you're a pet owner. So it's ideal if you don't want to breed your animal, you should probably spay her, because you don't need heat to happen. It's unnecessary. It's also best to spay a dog before she reaches puberty, which is around 6 months of age. And the reason for this is the sooner you spay her, the less likely she is to get reproductive cancers. Dogs can get breast cancer too. Who knew? So let's go over what happens during a spay. First, let's cover the tools of the trade, because what's a surgeon without their tools? First is the spay hook. A spay hook is a very simple instrument that just looks like a hook. It's used to dig for the uterus. I know that sounds pretty gross, digging for a uterus, but there's a lot of other structures in the abdominal cavity that the doctor does not want to remove. So it's important that he or she knows that she is truly removing the uterus and not something vital, like the intestines, or maybe a ureter, something that belongs near the kidneys. So you really want to make sure that you're removing the uterus, and a spay hook is used to help you find exactly that. The next tool that we can use is a clamp. Now these clamps right here look like some scissors, but they're not. They're blunt tipped, and they have flat ends that clamp down hard whenever they're clicked down. These are used to prevent blood flow from going somewhere. Think about when you take a hose and you kink it. You kind of bend the hose and it prevents it from flowing. It's the same thing with clamps. You just clamp off a vessel and then the blood flow no longer happens, which is really nice because you don't want a bunch of blood around your surgical site. You want to keep it clear, you want to keep it clean, so you know exactly what you're doing and you can see everything. The next tool is the scalpel. The scalpel does the cutting. I'm sure we've all heard of scalpels, whether it was on TV or in school. If you've ever dissected something, you probably used a scalpel. So here's a simple picture of a female reproductive tract. I included the kidneys. While they are not a part of the reproductive tract, it kind of gives you an idea of where we are in the body. So, first of all, there are the ovaries. Those are those little acorn-looking things at the top. Then there are the uterine horns, and then there's the uterine body. All of this is going to have to go, because this is all vital to an animal getting pregnant and an animal going through heat. So first off, we have to find the uterus. So we are going to use that spay hook that I was talking about earlier. We're going to use the spay hook to remove the uterus out of the body and bring it towards the body wall. Remember, we've cut an incision in the abdominal cavity. So we're going to bring that uterus out of that incision and lay it down on top. Now we're ready to start working. So our first step is to clamp off something called the ovarian pedicle. What's the ovarian pedicle, you ask? That's kind of a weird word we've probably never heard before. The ovarian pedicle is the blood supply that flows to the ovary. It's the collection of blood vessels that go from the aorta and the caudal vena cava. those are pretty big vessels that are important. So the blood flow through these vessels is pretty high pressure and pretty strong. So we're going to want to clamp that off because we're going to have to cut these vessels if we want to remove the ovaries. And we don't want those vessels bleeding everywhere. So we're going to clamp off those vessels before we do anything else. Now, something that's unique about clamping is that when you clamp something, you don't want to leave that tissue behind. It's being crushed with these clamps. So you don't want to clamp something, then unclamp it, and just let it reside in the animal. You need to remove whatever you clamp. So remember that. This is going to become important later on. So we've clamped off the blood flow that goes to the ovary, but we can't cut it just yet, because if we cut it, we're going to cut it closer to the aorta and the caudal vena cava, and that's going to bleed, and that's not going to be very good. So what we're going to do is we're going to tie off or ligate the vessels that are closer to the aorta and the caudal vena cava. That means that we're just going to take suture and we're going to put a little loop around it so that when we cut in between the clamps and the suture, things won't bleed at all. Doctors are pretty smart to think of this. So next, the scalpel is going to come in and they're going to do the slicing. So there's our scalpel and our vessels disappear. So now the right ovary is totally free and ready to be removed. But remember, we're going to remove everything all at once, so don't get too excited. All right, so next we're going to do the exact same thing that we did on the right ovary on the left ovary. I know my rights and lefts are a little weird, but remember, the animal is laying on her back, and right and left is in relation to her right and left, not our right and left. So we're going to do these same procedures. We're going to clamp the ovarian pedicle, and then we're going to ligate the vessels that are closer to the aorta and the caudal vena cava. The stuff that is ligated is going to remain inside the animal. The clamps are being removed because the clamps crush, and we don't want crushed tissue being left behind. That would be really bad. So there's the cut, and then the vessels disappear. So now our two ovaries are free. We're done, right? No, we're not. There's one more really big step left. What's that? We have to remove the uterine body. This is a bit of a challenge because the uterine body has a lot of blood flow going to it. That means lots of blood vessels, and things can get pretty messy. So what we're going to do is we're going to clamp off the uterine body because this is going to prevent the blood vessels from making a mess when we cut it. Once again, we're going to have to ligate something. There's a pattern here, right guys? So we're going to ligate the area that's going to stay behind. So we're ligating just at the top of the cervix. And now, you guessed it, we cut in between the clamps and the ligation. So now, we are free to remove the clamps and all of the reproductive organs attached to it. Ta-da! So it's all gone now, which is really nice. Now some of y'all might be wondering, not everything is gone, or the ligations are still there. So what's going to happen to them? Are they going to just stay in this female forever? That's a really good question, and the answer is they're going to dissolve. So no, they don't dissolve instantly, like sugar in water. They're going to take a few weeks, up to 3 weeks sometimes. So that gives the animal plenty of time for her vessels to heal and get a lot better before these sutures dissolve. Also, some of y'all might be wondering, why did we leave the cervix behind? Why didn't we just take that out too? The unique thing about animals is that they don't get cervical cancer as often as humans do. If you've ever heard of a hysterectomy with humans, that's when the uterus is removed and the cervix also goes with it. That's because humans could get cervical cancer, and that would be really bad. Dogs and cats don't really get cervical cancer, so it's not as important that we remove the cervix. It's okay to leave some behind. And with that cervix left behind, that can serve as a plug for bacteria that can ascend into the abdominal cavity. Remember, we made a big cut and did some majorly invasive stuff in her abdominal cavity. So we want to make sure that she's got some way to keep bacteria out. And the cervix is a really nice way to do it. Once it heals up, bacteria won't be able to get in at all. So there you have it, guys. After the suture dissolves, the female is completely reproductive tract free, and she can no longer get pregnant, she will no longer have a heat cycle, and she's at a much lower risk of cancer. So if you have a female dog and she hasn't been spayed already, do so. Wait until she's about 6 months old and make an appointment with your veterinarian. You'll do yourself a favor and you'll be doing her a really big favor. So remember to put your pet's health first and get your animals taken care of. Thank you, guys.